care home chiefs pleaded tonight to be saved from a second catastrophe as COVID infection rates escalate. More than 15,000 residents died in the first wave. Now bosses fear a devastating repeat unless they get the weekly tests for staff that Boris Johnson's ministers promised. Mark Adams, whose care homes lost 49 residents to COVID-19, said, "The government had a chance to fix this, but I can't imagine how they could have messed it up more." Close quote. Leaders across the care industry issued a stark warning that a deadly second wave of COVID will sweep through homes unless the government acts on its testing pledges. Bosses have been unable to secure promised weekly swabs for staff due to the test fiasco in which demand has far outstripped supply. What is your view? Have your say in the comments below. It means that workers can wait up to 10 days for their results, during which they are travelling in and out of care homes and possibly infecting residents. Mark Adams, Chief Executive of Community Integrated Care, which employs 4,500 staff and lost 49 residents during the pandemic, said his homes were no better protected than they were in May. He said, "It is inevitable our staff will be exposed to the virus. The only thing we have to protect us is testing." The government had the chance to fix this, but I can't imagine how they could have messed it up more if they had tried. No one in the sector is feeling the government has learned their lessons or that we are in a much better place than we were in this spring. We're just waiting to see the rise in the number of hospitalisations start to happen, and then the number of deaths. I think we are on that upward trajectory at the moment, and it is feeling a very, very scary place to be. We are going to see more deaths in care homes before we're through this. Department of Health documents this week reveal that COVID infection rates recorded through satellite tests, almost all of which are done in care homes, have increased fourfold since the start of September to 1,100 new cases a day. Health Secretary Matt Hancock claimed to have thrown a protective ring around care homes during the first wave. Despite that claim, there have been almost 27,000 excess deaths in care homes, with at least 15,000 due to COVID-19. Under the government's plans, staff should be tested weekly and residents monthly. But one care home boss who lost half his residents to coronavirus told how he was waiting up to 10 days for test results to come through. Waluube, 44, owner of Pelham House care home in Folkestone, Kent, said, "Testing is a huge problem. We are still waiting for results after 10 days, not to mention God knows how many weeks for the test kits to arrive. It will be a catastrophic problem if the tests run out. Testing comprehensively is crucial for the winter, otherwise we could see care homes thrown to the wolves once again." Close quote. Adam Purnell, care lead at Kepplegate residential home in Pree, Lancs, said, "It's taking 5 days for my home's COVID test results. We were promised weekly testing for all staff in July, then September, but it's not happening. Now we are all worried that the shambles we saw before summer is going to happen all over again." Close quote. With no sign of reliable rapid tests, thousands of families of care home residents face fresh distress as operators enforce tighter visiting restrictions. Care UK, one of the largest national operators, has already closed 48 of its 124 homes to visitors, mostly because of positive tests, or they are awaiting test results. HC1, the largest UK operator, has closed 133 of its homes to visitors and is restricting visits where wider community infection is high. Under the government's Winter Action Plan, published this week, visits would be halted in areas with high COVID cases except in exceptional circumstances. There are currently 40 areas listed by Public Health England where blanket bans could be introduced. John's campaign, which lobbies for the rights of dementia patients, said the 15,000-word document showed little compassion for frail residents. Company founder Julia Jones said, "For more than half a year, husbands and wives, committed partners, parents and children, have been kept apart. People are dying of heartbreak. In the name of safety, terrible damage is being inflicted on tens of thousands of people. This damage is avoidable. The solution cannot be to lock old folk away from any contact with their families during their final years. The grim truth is that only when the person they love is actually dying will they be allowed in to say goodbye." Close quote. In June, the Office of National Statistics reported a 52% rise above the average number of dementia deaths. This was the largest increase in non-COVID deaths compared to any other health condition and represented 5,404 excess deaths. But Mark Adams says providers are being put in an impossible position on whether to allow newcomers without tests or keep their residents isolated from outsiders. He said, "We would love nothing better than to reconnect families. But at the moment, if we don't let families in, we potentially face litigation on human rights abuse. And if we let people in and someone's family member dies because another family brought COVID into the home, we potentially face litigation." Close quote. Care associations have also revealed concerns over hints in Department for Health plans that homes could be asked to take patients from hospital without COVID-negative paperwork. The government insists homes can refuse. The union Unison, which represents care workers, called on the government to act quickly. National Officer Gavin Edwards said, "Promises about testing ring hollow all too often. Workers are facing a second wave with just empty words to protect them. Ministers need to fix things now. Tests should be available to care homes when they need them, with results back in 24 hours. The government has a second chance. They can't afford to blow it again." The Department for Health said, "We have been doing everything we can to ensure care home residents and staff are protected, including testing all residents and staff, providing 200 million items of PPE, £600 million, to prevent infections in care homes and making £3 7 billion available to councils to address the pandemic, including in adult social care. We are providing tests at an unprecedented scale, 225,000 a day on average in the last week. There has been significant demand. We are bringing in new technology to process tests faster." Close quote. Heartbreak of visits ban. These are the faces of Britain's care homes here. Breakers visits are halted. Christine Taylor has not hugged her 87-year-old mum Catherine Rush in 6 months and can only chat by phone. She was due to visit 2 weeks ago, but her hometown of Bolton, Lancs, was thrown into lockdown. Christine said, "It's awful. Mum is the first person we think of in the morning and the last thing at night. I just want to see her and know she is okay. Is that too much to ask?" Blind widow Susan Seaward, 88, was admitted with dementia to a home in Torrington, Devon, in July and has not been able to meet her daughter Hilary since. Hilary said, "I'm so desperate to see her, but I'm not allowed. She's already forgotten who my dad was after 65 years married." Close quote. Royal Navy veteran Gil Sloan, 81, who survived COVID but has vascular dementia, is unable to have visits from wife Joan, 74, in Chorley, Lancs. Daughter Maureen said, "I fear he will lose the will to live." Labour MP Liz Kendall, Shadow Minister for Social Care, said, "Ministers must listen to the very real concerns of families and care homes." Close quote.